So I think we can start. Good evening, everyone. Thank you for tuning in for today's session, which is part of the Wednesday webinar series. We're happy to have you. I'm Lteif, third-year medical student at UZEC and Lamsa ambassador. So at Lamsa, the Lebanese Association of Medical Services for Addiction, we aim to promote a sustainable and healthy community for the future by the youth and for the youth. We focus on awareness and prevention, education, and global outreach. I'm really excited to present you this webinar today about cancer and mental health, which will include an amazing testimonial by the amazing Elie Asswad, who is a great friend of mine, a fellow med student who suffered from aplastic anemia. Now, a little disclaimer, even though Elie didn't have cancer, I really think that his experience with the illness fits our topic for today. Before we start, kindly make sure your microphones are muted throughout the session. And if you have any questions or concerns, feel free to drop them in the chat box. So first, we're going to start with the idea of adjusting to a new normal, so why it fits cancer patients specifically. Next, I'll address some statistical facts and explain what chemo brain is. After that, I'll present briefly the prevention and early detection of cancer, even though I know that all of you know these things, but I think that it would be best if we bring these things up. Then we'll talk about how to cope with mental health impacts as a cancer patient and how to act when a friend or loved one gives you the news that they have cancer for the sake of their mental health. Now, and finally, we'll have the testimonial with Elie. And even though I already told you guys that Elie thankfully didn't have cancer, but I really think that his experience with aplastic anemia, being a teenager at only 14 years of age, is very relatable to cancer patients, which is a life-altering illness. Speaking of that subject, when we're talking about life-altering illnesses, we're typically talking about chronic illnesses or illnesses that will have a significant impact on quality of life and physical health. And these can range from cancer to muscular dystrophy, to dementia, to a whole host of autoimmune conditions like lupus. But these are illnesses that once you have this diagnosis, this is going to put into need the motion for the person who's been diagnosed with the illness to get very involved with medical treatment. And often there can be intensive acute medical treatment that follows, and then months or even years of follow-up treatment. So not only does the person's life course change for months or years in the face of that diagnosis, so too can the lives of the people around them. So it's really life-altering. And these medical illnesses don't necessarily mean someone's going to die, but people who receive these diagnoses find themselves immediately thinking about their own mortality. And you know, in my opinion, part of the beauty of human life is that people don't really have this idea of when their life is going to end. But when they do get a cancer diagnosis, they have these discussions about survivability and what is the likelihood of them surviving the cancer. And people start talking in months and years of how much time they might have life for. That can be extremely scary for someone to contemplate, especially when they feel that there is a ticking bomb of how much time they have left. And even though some people know that there is a probability or a possibility, or it runs in their family or whatever, every cancer patient is in shock when they are first diagnosed. And the reason for that is because it is such a drastic change to the thoughts and the plans that they've had for their own life, both short-term and long-term. And that's what makes it hard to accept. That's why it's shocking. Because I think most of the time, people like to think that good things are going to happen in the end. And suddenly, they are forced to adjust to a new normal. They are forced to hear the ticking bomb each and every second of their life. And that by itself can have a huge toll on their mental health. Now, why should we think about the link between cancer and mental health? Because mental health and these physical conditions, like cancer, are inextricably linked for many reasons. Number one, when a person gets a diagnosis of a significant chronic physical illness, there is often a period of grief and adjustment. A person may recognize, okay, my life is about to change. They may need to leave work. They may need to go on disability. They're definitely going to change the way they spend their time. Some people may immediately need to get a surgical treatment or some kind of intensive medical treatment, like chemotherapy or radiation or some other surgical treatments. It might be a financial stressor. Everything may not be covered. So people might be experiencing significant stress reactions and anxiety. But we also have to remember people who may already have mental health issues, who may have a history of depression, a history of anxiety, or any number of other long-standing mental health issues. For example, even a personality disorder. And the stress of a major medical diagnosis can exacerbate their existing mental health symptoms, or can be enough of a stressor that it might even foster the onset of significant psychiatric symptoms. So either it's long-standing mental health conditions, or it can really get those symptoms going. A person, for example, having paralytic anxiety, they can't sleep, they can't stop thinking about this diagnosis and being fearful of it. And then we have to look at the next step of this, which is that mental health symptoms can interfere with how someone engages in their own medical treatment. So, for example, there's a very robust literature showing that having mental health symptoms, depression, anxiety, a history of past or ongoing substance use, but anything that impacts mental health can negatively affect adherence. Adherence to pills you're being taken to take at home, physical therapy, showing up at doctor's appointments, anything that requires follow-through on the patient's behalf as they go on. Now let's get some statistical facts out of the way. First of all, major or clinical depression makes it hard for a person to function and follow treatment plans. It happens in about 1 in 4 people with cancer, but it can be managed. And as we've already discussed, people who have had depression before are more likely to have depression after their cancer diagnosis. Second, people with mental illnesses have increased mortality from cancer, which cannot always be explained by increased incidence. But possible explanations can be either delays in detection or initial presentation, leading to more advanced staging at diagnosis, or difficulties in communication or access to healthcare. And lastly, chemobrain affects up to 75% of patients during treatment, with 35% reporting symptoms post-treatment. Now you're probably asking yourselves, what is chemobrain? Well, chemobrain is a sort of mental fog that affects a patient's overall cognitive function. So it can be described as thinking and memory problems that can happen during and post-cancer treatment. But symptoms are subtle and often go unnoticed, like difficulty remembering dates, names, phone numbers, trouble concentrating and multitasking. And while the exact cause for chemobrain is still under discovery, there are many possible factors that might contribute to the signs and symptoms of memory problems in cancer survivors. First, it can be caused by the cancer itself, either in the case of brain cancers or the consequence of cancer-related anxiety and depression, which can contribute to thinking and memory problems. Second, it could be caused by the cancer treatment, especially by chemotherapy, where anthracycline was proved to negatively affect verbal memory. Third, it could be caused by complications of the cancer treatment, like anemia, infection, fatigue, sleep problems, hormonal changes, and finally, other causes like inherited susceptibility to chemobrain. And now there are no tests to diagnose chemobrain, while cancer survivors who experience these symptoms often score within normal ranges on memory tests. But doctors may recommend blood tests, brain scans, or other tests to eliminate the probability of the presence of other causes for the memory problems. Now for the treatment part, chemobrain treatment focuses on coping with symptoms. Like we said, cancer and cancer treatment can lead to other conditions such as anemia, depression, sleep problems, and early menopause, which may worsen memory problems. Controlling these other factors may make it easier to cope with chemobrain. And unfortunately, no medications have been approved to treat chemobrain. So worst case scenario, medications approved for other conditions like Alzheimer's, ADD, ADHD may be considered. Now, you've probably heard conflicting reports about cancer prevention, and sometimes a specific cancer prevention tip recommended in one study is advised against in another. And often what's known about cancer prevention is still evolving. However, it's well accepted that your chances of developing cancer are affected by the lifestyle choices you make. First, using any type of tobacco puts you on a collision course with cancer. As you already know, smoking has been linked to various types of cancer, including cancer of the lung, mouth, throat, larynx, pancreas, cervix, bladder, kidney, etc. And even if you don't use tobacco, exposure to secondhand smoke might increase your risk. So avoiding tobacco, or better yet, deciding to stop using it, is an important part of cancer prevention. Second comes eating a healthy diet, which, although making healthy selections at the grocery store and at mealtime can't guarantee cancer prevention, but it might reduce the risk. So you may want to consider eating plenty of fruits and vegetables, maintaining a healthy weight, limiting processed meats, and if you do choose to drink alcohol, do so only in moderation. And third comes skin cancer, which is one of the most common kinds of cancer and one of the most preventable, either by staying in the shade as much as you need to or putting on sunscreen. And after sun exposure comes viral infections. You should consider getting vaccinated, especially against hepatitis B, which can increase the risk of developing liver cancer, and HPV, the human papilloma virus, which is a sexually transmitted virus that can lead to cervical and other genital cancers as well. And another effective cancer prevention tactic is to avoid risky behaviors that can lead to infections that in turn might increase the risk of cancer, like practicing unprotected sex and sharing needles. Now, jumping onto early detection, screening tests look for cancer in people who are asymptomatic. These tests can help find some cancers early when they're likely to be small and easier to treat. And tests for some cancers can even help prevent them by finding and removing precancer growths. Now, generally, men don't need to be concerned about starting cancer screening until age 45, and women around 40 to 44, that's when they should have the choice to start annual breast cancer screening with mammograms if they wish to do so. Now, for starters, when it comes to coping with cancer, there are a number of different areas that people often describe having to cope with. To begin, there is coping with a cancer diagnosis. People often have to manage the emotions of cancer, learn how to deal with the physical symptoms, cope with life changes that can happen through cancer, try to re-navigate relationships, encounter spiritual or existential distress, and deal with the after effects in life after treatment. Now, what I want you to focus on today, and what the time allows us, is item number one, coping with a diagnosis of cancer. So the first thing to keep in mind is that when it comes to being diagnosed with cancer, everybody reacts differently. There is no right way to do this, really, no wrong way to do this either. I'll read you some quotes from patients that I've read from testimonials on the web, and you'll see just how varied people's reactions can be. It felt like I was hit by a bus, like my whole world came crashing down on me in an instant. My mind was racing. I couldn't think straight. It was like a million things going through my head all at once, and yet I couldn't possibly articulate any of them. What would all of this mean for my life? Does this mean that I'm dying? Somebody else said, I felt completely numb. It's like I heard every word the doctor said. I remember every moment of it, but I had zero emotion. Everyone expected me to feel sad, afraid. Heck, I even expected that. It's weird, for weeks, I never felt sad about cancer. And so you can see just how varied people's reactions can be when they get diagnosed with cancer. The initial emotional reactions can range from shock, fear, anxiety, loneliness, all the way through to sadness or depression, feeling overwhelmed, feeling guilty, or sometimes hopefulness and gratitude. Now, let's talk a little bit about waiting. When it comes to being diagnosed with cancer, waiting really is the name of the game. You can see on the schematic on the left side that often people start off recognizing a symptom, maybe a lump or a bump or any other symptom, and they might go see their family doctor or another specialist. They might have some tests done, and sometimes they get a finding that seems like it could be cancer that often is followed by a biopsy, where a certain amount of tissue is taken, looked at under the microscope. And then a definitive diagnosis of cancer can be made. But even after that, people often need more tests. We call that staging tests in order to try to figure out not only how big the tumor is, but whether it's spread to any lymph nodes or spread elsewhere in the body. And nowadays, there's sometimes even more tests like genetic testing that can be done, which can often help the oncologist decide what the right treatment plan needs to be. You can see there is a lot of waiting. And as some of you might already know, it can be really, really terrible for people during this period of waiting. Here's another quote. This was the worst part of the journey for me. That period of waiting at the beginning, not knowing what the test results would show. They couldn't even tell me if I would need chemo, radiation, surgery. We had no clue how bad it was. I was trying to keep it together for my husband, for my kids especially, but I was terrified and there was no pill that could take that away. I just had to wait. So people often ask, what can I do? What can I do during this period when receiving a diagnosis of cancer? And again, while there is no one size fits all and there is no rule book, there are some tips that seem to be quite helpful. So let's go through them. First, people can find it very helpful to get organized. Here's a quote, and if we could have a volunteer to read it, it would be awesome. So maybe Dion, can you read it, please?
What nobody talks about is just how many bloody appointments they schedule. It's like my entire life became about doctor's visits. Not just doctors, blood tests, scans. I can't even tell how much I was poked and prodded. I've never kept a journal before, but I knew that if I didn't, I'd never remember all of my appointments. So I started using a calendar in my phone to keep myself organized.
Awesome. Thank you so much, Dion. Another tip is understanding who's part of the team. Here's another quote. Sarah, can you read it, please? Hayek.
Suddenly, I was part of a huge team of doctors, nurses. There were even social workers to help me apply for disability. It was actually a little scary at first because a whole team walked into the room, but when I realized that I'm actually a part of the team too, it felt like I regained something that I thought I had lost.
Awesome. Thank you, Sarah. Now, there are a number of different players that can be involved in the team, and it's really important to understand who they are and what their roles are. Now, Leia, can you read this one, please?
They always say to avoid Dr. Who. Well, I'm me to know kind of person. So I told my doctor, and that's where I got most of my answers. It's like I'm gonna do research, so I might as well go to the right sources.
Awesome. Thank you, Leia. Guys, I can't stress this enough. It's so important to go to reputable sources. It's not that blogs and other sites, whether mainstream or obscure, are necessarily badly intentioned, but they're not necessarily valid, and they don't necessarily have the type of evidence-based information that you'll get on other more reputable sites. Now, it's really important to ask questions. Nada, can you read these ones, please?
The nurses are probably sick of me at this point, as I ask them so many questions, but I need to. My doctor asked me how much I wanted to know. I said I wanted to know everything, the good, the bad, and the ugly. I told her I didn't want to know my prognosis. Why would anyone want to know that? But we agreed that she'll let me know if I need to worry.
Amazing. Thank you, Nada. You can see that again, there is no one size fits all, and that different people really prefer different approaches when it comes to getting informed and asking questions. Next comes trying to be kind to yourself. I'll read this one. I'm just trying to keep a bit of a routine while I'm waiting. Like, what else can I possibly do? So I'm waking up, I'm going for a walk before I wake the kids up, just to have a bit of me time. Otherwise, I just lie in bed and stew. So it's very important to keep a routine. And if that routine happens to involve healthy eating and exercise, spending time with family or other things that you enjoy, all the better. So in summary, for most people, a new diagnosis of cancer is stressful. That's exactly how it's supposed to feel. People can experience a range of emotions, and there is no one single right way to feel or wrong way to feel. It's a period of time that's really marked by uncertainty. And given that from a psychological standpoint, uncertainty is really what fuels anxiety. We always tell people to arm themselves with information. Might be information about the diagnosis, might be information about who the various team members are, the various players. But try to get informed if that's something that's in line with your wishes. And lastly, ask for help, and hopefully your team can hook you up with somebody who can address whatever the needs are. Now, just before we have the testimonial, we're going to end the talk on how to act facing the diagnosis of a loved one. So in the moment of getting that news, we'd all like to think we're graceful and I'm so sorry. How can I be there for you? Some of us might cry, scream, yell, say things like, how can this be? Some people may be very appropriate to say, I'm so sorry. We don't know how we're going to react. Like we'd like to think we will, but I don't think that there is a should. I think a gold standard to sort of strive for is to not bring more distress into the life of the person who is already experiencing the illness, to be as empathic as possible, and to find out how you can be helpful to them, even if that just means doing nothing. Guys, please, I want you to remember that doing nothing is often a good thing. And that's where people get frustrated, as if the thing they're being asked to do is nothing. But as long as you're doing whatever they wish you to do, you're on the safe side. And last but not least, try as much as you can to not compare them to anyone. Some people might go like my grandfather or someone I know had the same type of cancer and tell the story in the hopes of relieving them. But it's about them now. Don't compare them to other cases. And I think Elie would agree on this. As an aplastic anemia survivor, he always had people try to relieve him in a way or another that was counterproductive. Elie, are you with us?
Yes, good evening, everyone.
Hi, Elie. I hope everything's fine.
Yes, alhamdulillah.
Elie, just like I was saying, there is definitely some ways that people unintentionally use in the hopes of relieving people that suffer from chronic illnesses, like cancer or aplastic anemia, that are counterproductive. Could you give us some context on how to act in such situations based on your experience, of course?
I mean, you already put it into words amazingly. Adding to that, I'd just like to specify on having a patient that is undergoing these specific things feel like they're inferior. Like, for example, I start to treat you like you're different. I start to try to overcompensate for my own fear of that other person. In a way, it makes us feel very inferior and invalidated and pity. When other people feel like they're forced to act in a certain way towards that person, it's, in my opinion, it's one of the most destructive things that you could unintentionally do to the person. And other than that, I think you've already explained amazingly how to act and how not to act.
I couldn't have said it any better. And if I can add to that, when people act like this, you suddenly feel that they view you differently just because you have aplastic anemia. You think that they don't see you as the Elie who is 14 years old, going through these teenage years, going to school, who on the side of things has an illness called aplastic anemia. But rather you suddenly think that in their point of view, you're just Elie who has aplastic anemia. And all of that can be avoided by what you just said, which is awesome. Thank you for bringing that up. Now, Elie, it would be great if you explain to us what aplastic anemia is briefly.
Okay, so aplastic anemia is, at least in my case, it's a very rare disease that is a progressive weakening of my bone marrow up until it stopped producing red blood cells and platelets and immune cells. So it got to a certain point where I had little to no immunity. Anything close to a speck of dust could be the decider of whether I'm going to live or not. I needed to be quarantined for a long time. I used to bruise up very easily. I would sometimes start bleeding out of nowhere, especially under my skin, because of the lack of platelets, because I was in very much distress. I lost the ability to be an independent individual. I needed to rely on my family and my friends for the most basic of tasks, such as, and excuse my language, going to the bathroom or taking a shower or just getting out of bed. I needed a lot of blood and platelet transfusions and immunity shots And it was a very, very stressful period because we really didn't know what to expect. It was very new at the time.
I can't imagine at all. How did you feel when you first received the news?
Okay, so I was already at the hospital because I had a fever that just wouldn't go away for a couple of days. And my pediatrician actually called for Dr. Peter Noon, which is an oncologist at Mount, amongst others. And he ran some tests. He did a biopsy for my bone marrow, talked to my parents aside. This is where I felt like something's wrong. And my mom actually told me that I have aplastic anemia. And she explained as best as she could what that meant. At first, I was in complete denial. I didn't know how to act. I didn't know how to feel. And then slowly but surely, fear started to go in. I didn't understand that. I feel like if there's anyone that's going to be faced with such a major thing or a major life-changing thing, especially when you're like 11 or 12 years old, they're going to act a certain way, but I was lost. I still couldn't understand why me? Why is that happening to me? What did I do wrong? And I started to guilt trip myself into thinking, oh, I probably deserved it. I then went ahead and did my research, asked a lot of questions. Uh, Everyone from both hospitals where I've been have heard enough of me just wanting to know what's next, what's going to happen. And I was basically trying my best to cope after that.
So did you have a support network to support you through these hard times?
I did. I felt like I was alone, but I wasn't. My family was there, my parents, and especially my mom. She fought so hard to not let me go for a long time. Either it was at the hospital, at home. My school and my school friends both were here. My school let me and allowed me to continue a year and a half worth of studying at home, studying at my own pace, and actually
Wow.
having exams from home. So I didn't miss out on anything. And I had my best friend come home from school every single day just to tell me everything that's happening. They kind of made me feel like I was human, as weird as it sounds, because to a certain point, I didn't feel that. I really didn't feel that. Faith helped me a lot. I had a lot of support spiritually, if I might say. It was always a very shaky relationship, but I feel like at this specific point in my life, faith did help a lot to actually make me the person that I am today, essentially.
Amazing, amazing. Can you tell me about your treatment process? The good, the bad?
Yeah. So initially, when I had aplastic anemia, they told me it was either one of three paths. Either it was going to stay that way and it was going to progressively get worse up until my bone marrow would just stop working. It could change to blood cancer, leukemia, or a specific type of lymphoma. Or the worst case was it could just turn into a sudden death where I just stop completely. So at some point, my doctor wished that it would turn into blood cancer because then we know we have chemotherapy, we have screening, we have this, and that. We did a very experimental immunotherapy treatment where I was on immunosuppressants and heavy anti-lymphocyte medication in hopes that it would kind of make like an entire reboot of my bone marrow for it to start working again. It was very experimental. We didn't know how long it was going to take, if it's going to work.
There was no
And
guarantee.
I am
Yeah.
at all. I'm very lucky to say that I'm one of the first, if not the only few in Lebanon at least, who got cured from that. So yeah.
I can't imagine at all. Did you face any obstacles during your treatment process?
Pain mostly. It's essentially breaking myself down from the inside in order to rebuild up. So my body would have severe reactions to everything, especially to the anti-lymphocyte serum. I suffered a lot of loneliness. I wasn't alone, obviously. I had my friends, I had my family. But when you're stuck in a room, I think we can all imagine that because of COVID. But when you're stuck in quarantine from everyone, you kind of lose a sense of yourself. And I, again, didn't feel human. I was very dependent on my family for the most basic of things. And I always felt bad, like I'm the reason why they're sad. I'm the reason why they're having to go through that. And that threw me down a very, very dark rabbit hole. But I think what helped me the most was my parents were treating me as an adult, and they would always have mature talks with me. Like they would ask the doctor to give me the diagnosis, to talk to me directly, not to hide anything, even the ugliest of things. I remember once in this very room, we had a serious talk of what if nothing works? What if I die? What happens next? Is it going to be painful? And as a 12 to 13-year-old at that point, I think the moment you start realizing your own mortality, there's no going back from that. You
Exactly.
realize that, yeah. But I think slowly rejoining society, from starting to wear masks and trying to go out a bit more, even if it's just very short walks when I started to get better, talking to my friends more, having people over with masks, of course. I think this slow reintroduction to human society, was, I think, like a very big breath of fresh air that I really needed in this very dark time. I feel that.
So what message would you like to provide to the youth who themselves or have people who are close to them diagnosed with cancer or other life-altering illnesses?
Okay, so I think one thing that I realized a bit late was just stop worrying about the why of things, like why this, why me, what did I do to deserve that? And I struggled with that for a long time, for months to years. And then I realized at some point that regardless of why, it will always get to a certain point where I will benefit from this, or that my life will change in a specific direction from this. There's something that has really been said over and over again that I felt that was very cheesy, which is everything happens for a reason. And it does, because from the relationships that I've made, from the professional guidance that I've had, from my life path, I'm a third-year medical student, and I never would have imagined I would end up here or even there giving this testimony for other people. It's in a way gratifying to know that all of this happened because I didn't give up and because I stopped worrying about why and I stopped blaming myself. And the moment I stopped doing that, even physically, I started to get better. Even my blood count wasn't dropping as low. My tests weren't as terrible. And you kind of help yourself by letting yourself breathe, by letting yourself work, by letting higher powers work on you. And I feel like for other people and for the patients themselves is just don't shut people out or yourself out, as tempting as it is, as much as you think you need it. It's a temporary solution to a bigger problem. Patients are already fighting for their physical health. They can't manage to battle themselves mentally at the same time. You need to speak up, ask for help, pray, rant, cry, do whatever it is that you need to do to take everything that you're holding in, getting outside, talk to family, friends, love interests, even pets. Just do anything in your power not to go down that rabbit hole, because as you said, with the interaction between mental health and physical health, there's a huge bond, there's a huge link, and don't make it worse for yourself by just shutting out. And most of all, and I think that has been said over and over again, don't give up, because the worst is behind you, and there's such an amazing future, and that's so bright and that's so different and weird at times, that's just waiting for you at the end of the road. I guess that's pretty much it.
Goosebumps. I can't describe, Amjad. Elie, I can't thank you enough. Thank you so much for joining today and
Thank you
answering
for
these
having me.
questions. It means a lot, Anjad. So guys, I think our webinar has
Thank
come
you.
to an end. If you have any questions for me or Elie, feel free to ask them via the microphone or the chat box. Even though I think the meeting might end in 3 minutes, so I think it should be quick. Guys, don't hesitate, Amjad. Feel free. Thank you for your comments. Lilin, Maria. Okay, so it seems that there isn't any questions. Thank you so much for tuning in today, guys. It was an honor to present this webinar to you guys. And Elie, thank you again for joining. Bye-bye.